Alright team, listen up. The patient presents with nephritis, proctitis, and subacromial bursitis. What do you think we're dealing with here?
Nephritis and proctitis could point towards an infectious process, while subacromial bursitis might indicate an inflammatory condition.
I'm leaning more towards an autoimmune disorder with these symptoms. The patient might have something like lupus or rheumatoid arthritis.
I'm not so sure about that. These symptoms could also be signs of a rare cardiac tumor. We should consider running more tests to confirm.
I agree with Randall. Let's not jump to conclusions just yet. We need more information before deciding on a treatment plan.
Enough. I've made my diagnosis. It's papillary fibrillastoma, and we're going to perform exeresis immediately.
But Hawks, that's a risky procedure. Are you sure that's the right call?
I didn't ask for your opinion, Gary. We're going ahead with the exeresis. This patient's life is in our hands, and we will do whatever it takes to save them. No! Scrub up! We don't have time to waste! Tracy, I need to perform exeresis on my patient. I am confident that they have papillary fibrillastoma, and it needs to be done urgently.
Hawks, I understand your concern, but we need to make sure we have all the necessary evidence before proceeding with such a risky procedure.
Evidence? I have years of experience in this field, Tracy. You can't just question my judgment based on statistics and past cases.
Hawks, I respect your expertise, but let's not forget the times you were wrong in the past. We can't afford to make mistakes, especially with such a delicate surgery.
But this is different, Tracy. Trust me on this one. I know what I'm doing.
I'm just concerned, Hawks. Let's discuss this further with the team before making any hasty decisions. We need to consider all the options and risks involved.
Fine, but I'm telling you, Tracy, I know what's best for my patient. We can't waste any more time.
Leslie, I just checked on the patient, and it's not looking good. The exeresis didn't work for the papillary fibrillastoma.
Oh no, that's terrible news. Do you think we should inform Hawks about this?
I think we have to. He needs to know that the treatment didn't go as planned.
But Frank, right now our priority should be the patient. Hawks can wait. Let's focus on how we can help them in this critical condition.
You're right, Leslie. The patient comes first. We'll figure out how to handle Hawks later. Let's do everything we can to save them.
What the hell were you all thinking? How can you be so incompetent? You nearly killed our patient with your wrong choices of exeresis and diagnosis.
I told you it was a risky move, but you insisted on going through with it.
I thought we were on the right track. I didn't expect this outcome.
I still believe we were right. I stand by our decision.
Maybe we made a mistake, but we were just trying to do our best under pressure.
Your best. This is a disaster. You call this your best? I should have trusted my gut and not rely on the likes of you. Incompetence at its finest.
Well, what do you suggest the diagnosis is now, Dr. Hawks?
I don't need suggestions from you fools. I'll figure it out myself. You all stay here and try not to mess things up even more. Goodbye. So Johnson, how's everything going outside of work lately?
Oh, same old, trying to balance work with family time. How about you, Hawks?
Not much time for personal life lately. This new case has really got me thinking. Something doesn't add up.
That's rough. Hopefully you'll figure it out soon.
Wait a minute. I think I know what's wrong with my patient. Johnson, I have to go check something. See you later.
Wait, why? Hawks. Wait, okay then, catch you later, I guess.
I've made a breakthrough, guys. It's not papillary fibrillastoma, it's histidynemia.
Histidynemia? Are you sure, Hawks? That's a rare metabolic disorder.
Hawks, you can't just barge in here without proper gear. You're risking contamination.
This is outrageous. We have protocols for a reason. Hawks, show some respect for the patients and the team.
I know what I'm doing. The prognosis for histidynemia is good with early detection and treatment. We can save this patient.
Well, if that's really the case, then I guess we should run some tests to confirm your diagnosis, Hawks.
Let's get to work then. We don't have much time. But next time, please follow the safety procedures, Hawks. It's for everyone's benefit.
Understood. Let's get this patient the help they need. Tracy, I have to admit I found the right diagnosis for the patient.
That's great to hear, Hawks. The patient must be relieved.
It's a shame the wrong diagnosis happened in the first place.
What do you mean by that, Hawks?
You know what, who initially declared the wrong diagnosis.
Well, if my team were more competent, this wouldn't have happened.
Hawks, you can't shift blame to your team when you were the one who made the mistake.
I need to go check on the patient. Excuse me, Tracy.
That's unusual. You usually go home afterwards.
I know. I need to prep them for surgery again because Gary stitched my car keys inside their abdomen as a prank.